I'm Dr. Jackie Epperson for Bio-Identical Hormones Incorporated. We here at Bio-Identical Hormones have a new program available for those who are seeking hormone replacement therapy. Millions have documented great benefits from hormone replacement over the years. It's important to note that hormones act differently in different animals. Different medications act differently in different animals. Whereas a cat may be given an aspirin, it could be lethal. It would be very helpful for a person to take an aspirin for a headache. The same is true for hormones, and the most common hormone replacement used for women is Premarin. Premarin is derived from horses, and it contains over 50 different types of estrogens. Our bodies contain enzymes to deal with chemicals, and we also have receptors in our body to deal with hormones. These receptors and enzymes are very specific for the chemicals involved. We believe that these hormones need to be the exact match to the same hormones that the body would normally make. The enzymes that are present can't match up with the horse hormones, and therefore the breakdown products and how these are broken down are really not known in the body. There is some increased risk of problems that we feel that animal hormones cause that the synthetic normal human hormones would not cause. Animal hormones as well as human hormones do have some risk factors involved. Some studies have shown a slight increase in breast cancer risk and possibly some risk factors related to increased blood clots. These have not really been shown for bioidentical hormones, as these studies are underway but have not been completed. But the fact of the matter is that so many women benefit greatly from hormone replacement. Many can't function because of the hot flashes, lack of sleep, and lack of energy, and really some very difficult mental issues because they don't have the hormones on board. We believe that bioidentical hormones offer the greatest benefit with the least risk. Not everyone is a candidate for these hormones, and you certainly have to be checked for that. And many are not having severe problems with their menopause hormones, and so they may not want to have this done. But those who are having symptoms such as loss of energy, vaginal dryness, lack of sex drive, they can be greatly helped by bioidentical hormones. In America, there are approximately 40,000 deaths a year from breast cancer, and luckily this number is decreasing. At the same time, we have over 70,000 women dying from fractures of osteoporosis, and we know that hormones prevent fractures. Also included, another 70,000 women are ending up in nursing homes because of these fractures and the complications of this. We know that hormone replacement improves this. Also, women need testosterone replacement. Many women have very low levels of that, and naturally in the premenopausal state, there is some level of testosterone in the woman's body. Symptoms include having low energy levels and a low sex drive when the testosterone in a woman is low. The replacement of testosterone is very safe, and certainly lower amounts are used for women. With estrogen replacement, there can be some mild side effects of breast tenderness and vaginal bleeding for those who still have a uterus. Some will have a little water weight gain, but most have very minimal symptoms with hormone replacement, especially bioidentical hormone replacement. With any testosterone replacement, it is noted that some will have a little facial hair thickening or thickening of hair in the body and may have some acne problems, but most are not bothered by this, and again, this is carefully monitored in our program. We do know that testosterone does decrease the risk of breast cancer, and it does help harden bones and reduce fracture risk. The skin irritation is one of the problems with hormone replacement that is done through the skin. The other problem is that most people take hormones, they take them by mouth, and it has to go through the liver. The liver has to process these chemicals, and it's a phenomenon we call the first pass effect. This can greatly affect the fact that we need to put more hormones into the body because these are eaten by the liver, and it's just not the best way to deliver the hormone. We also use the patches and topicals to apply hormones, but at times we find that the skin has problems with absorbing these, and you can get irregularities with this. We at Bio-Identical Hormones believe that you need to have hormone pellets for the best replacement therapy. This allows for a more even distribution and flow of the hormones from the site that they're placed, and we find much better results when we do use this. Our aim is to help you with your treatment as safely as possible, to relieve your symptoms, and to follow the newest and the best scientific information that has been published as we keep up with that frequently. Our goal is your best health. It's your health. Let us help you keep and improve it.
I'd like to introduce Suzanne Summers.
Lost my slipper. What an entrance. Hi. How are you? Good to see you.
You look wonderful.
Thank you, Ron. Thank you. Wow. God, you procreated since last year. That's what happens in this whole anti-aging world. I'm so privileged to be here. I'm so privileged to be your messenger. I know you didn't choose me, and I didn't really choose you. This came from a passion that something was not working right. I remember when I was a little girl, Elizabeth Taylor was on the cover of Life magazine. And the reason she was on the cover of Life magazine is nobody could believe that a woman could look good at 40. They celebrated 40. I remember thinking, God, she's old, but she looks good. Well, now 40 is, you know, you're still a lot of 40-year-olds still living with their parents. Oh God, that's not a knock on the door you don't want, isn't it? Hi, Ma. No, go away. And then in the 60s, Gloria Steinem, who's a little older than I am, was on the cover of People magazine because she looked good for 40. And I remember her saying at a press conference, she said, this is what 40 looks like. So I'm here to tell you today that this is what 60 looks like. Yeah! Thanks to you and what you're doing. I've been de-virused, I've been detoxed, I've been HGH'd and progesterone and testosterone and estrogen and DHDA and pregnenolone, and I've had intravenous C and I've had intravenous glutathione. I do it all, and it's so great. I feel so great, and I really believe that right now we're at a crossroads. And the crossroads are a choice. And I don't know about you, but I don't try to convince people anymore. It's just too exhausting. It takes too much energy. But the crossroads, as you know, are you can either choose where you want. You can choose 50-year-old medicine. Is that what you want? Fine, and take all your pharmaceutical drugs and end up in a nursing home. Or you can jump on this fast-moving train. And this fast-moving train is why we're all here. It makes so much sense. I have always connected dots. That's what I do. And it makes absolute perfect sense to me that as we age and we decline, that you want to put back what you've lost in the aging process. Now, my husband's cousin is a gynecologist. I won't even tell what part of the country, so he doesn't know I'm telling this story on him. Anyway, I was giving a lecture in this part of the country to women, and women, by the way, are so hungry for this information. When I give a lecture in any town, always 2,000, 2,500, sometimes 3,000 women show up. It is so incredible, and you can't hear a pin drop because they just want someone to give them some clarification. And although I never give advice, what I'm able to do is say what I did for me and then direct them to one of you when I know about you and what you are doing. So anyway, my cousin, my husband's on my husband's side of the family, my cousin comes up to me after the lecture, and he didn't come to the lecture because he says, I don't even have time to keep up with standard of care. And I thought, you are the problem. And he said to me, Suzanne, menopause is a natural state. Just let nature take its course. And I said, then let us die. You won't let us die. We used to die when nature took its course. We used to die at the turn of the century at 40, 45. And then antibiotics and sewage and technology came along, and we lived to 60, 65. But you know now, we're going to live to 90, 100, 120. Some people are going beyond that. I'll take 120. I said, if they're going to prolong our lives, then I want to have quality of life, because I think there's a racket going on right now. And the racket in standard of care, well-meaning though it is, I'm not putting it down. It's well-meaning. But you don't know what you don't know. I really think at some point, with all the talk about anti-aging, longevity, bioidentical hormones, if I were a doctor and I didn't know anything about it and I didn't learn it in school, I'd come to one of these conferences, I'd take a course, I'd go, hey, what is that you're all talking about? So when they keep us alive this long, we want to have that quality of life. But the racket is that we reach a certain age, and for women it happens so fast, it's in our face. We start losing our hormones, and then we lose 90% of our hormones over a 2-year period, and we feel awful. And I know we're not fun to live with at all. That I know. And when we live this long and we don't put the hormones back, you go to the doctor and you say, I'm so depressed and I can't sleep and I've got allergies and my eyes are watering and my skin itches and I don't have any sex drive and I just don't feel like I used to feel. And what's the first thing that woman gets? Prozac. There is not one woman out there with a Prozac deficiency. And so I watch my girlfriends, and you know, for all of you who are in this business, you can't convince your family, right? And you can't convince your best friends because they've known you forever, and what do you know? So I have all these girlfriends who are on what I call the menopause cocktail. Prozac, Ambien, Claritin, anti-anxiety, say Valium, pain medication for all the joint pain, the hip pain, the knee pain, knees that are going out, hips that are going out, minds that they're losing. And what do they get is this menopause cocktail of all these drugs. Now, for those of you who are really into this, you know that accumulation of chemicals eventually, and the family doesn't want to, and they feel really bad, but it's just so hard to take care of them anymore, and I'm afraid if I leave her at the house, that she'll set the house on fire, or she runs away, or he can't remember anything, and so I felt so badly, but I had to put them in a nursing home. But it's a nice one. It's a good one. And that's the racket. The racket is from the menopause cocktail, and the same version for men, straight into the nursing home. And when I talk to people, I go, it's not too late until you're in that nursing home. Once you're in there, it's too late. Whenever I write a book, the last 3, I've done this twice, with each book that I've written on the hormones, I go to a nursing home. I went to one in Toronto, I went to one in Miami, same thing in both places. You walk in, all the old people are tied to their wheelchairs, they're drugged on something because all their mouths are hanging open. If one yells, the whole hallway yells, and it is the most depressing place. There is not one person in this room who can conceive of ever ending up in a nursing home. And probably in this room you won't, because you know, you get it, you're onto it. But outside of this room, I'll tell you, it's a direct route. And it's a tragedy. Here you're doing all this incredible work so we can live longer and take advantage of this long life, and it is incredible. Once your kids are out of the house and they're married and they've got their own mortgage and it's not your problem anymore, you look at your husband and go, hey, it's nice. And remember me, I've got a sex drive because I'm on bioidentical hormones. And let's not discount that. I had a couple of years there before I found this where I had no sex drive. And it was humiliating because I was sort of known in my younger years as a sex symbol. And I thought, this is terrible that the sex symbol has no sex drive. I better not tell anybody, including my husband. Because, you know, we can fake it. But frankly, I'd rather have a smoothie. And then I found bioidentical hormones. And woohoo! Wow, it's great. You know, I talk to women, they go, oh, I'm glad that's over with, and oh, I'm glad I'm past that. I go, oh, you just forgot. You just forgot how nice it is. And it's so lovely to be married at this age and not be married to someone who is looking over your shoulder when you're dancing, because there's a sexuality between you. There's pheromones between you. When I'm in a room, I can tell who are on hormones or who still have their hormones. We put out pheromones. They're not, you can't see them, but you can feel them around someone. There's an electricity between people who still have their sex hormones.
A woman at age 20 has, on average, twice the testosterone that she will at age 40. So if you compare an average woman at age 20 to a woman at age 40 with half the testosterone, at age 20, you're on top of the world. You have absolutely no reason to be. You have no finance. You have no control of anything that's going on. You are going to school, working a part-time job. You have a social calendar. You have your family, your mom and dad, brothers, sisters to interact with. You get maybe 3 hours of sleep at night, and yet that is when we usually feel the best in the world. Fast forward now to age 40, 45, 50, where now you've worked 20 or 30 years to get to where you are, career, family, some finance starting to come together for you, and yet you end up in the fetal position crying in the corner because you feel like the world is caving in around you. A lot of that has to do with testosterone and how it makes you feel. Testosterone is the feel-good hormone. And a lot of people will say that libido and testosterone and women are the trio. My take on libido and testosterone in women is that it's a far more complex response, and that if you can take a woman that feels awful about everything, that has no confidence and no sense of well-being and just feels like everything is crashing down around her, and take all that away so that now she feels like she's in control and she feels like she has energy and she's not so fatigued, then libido is something that will come out of that secondarily. New England Journal studies showed that women with low libido and low testosterone, they had their testosterone replaced, and then 80% of them had their libido increase. It didn't look at other forms of well-being, though. It just looked at straight up libido. So that's something to think about, but it's really the big well-being and energy, and builds bone. So how do you treat menopause? Herbs have been around for a long time, Chinese herbs. They have some biologic activity. I have a lot of women that come to me in my clinic and say, I've been taking these herbs and they worked for a while, but they just don't work anymore. I'm starting to break through those herbs, and they want to know if they can stay on them. Sure, probably you can. Let's start up some hormones though and see if that can make it even better. Synthetic hormones came along after the herbs, and so this is the stuff that we don't want to use now because we think there are a lot of problems with it, and that's what the Women's Health Initiative showed. But that was the next step, and then we're going on to bioidentical hormones now, which is the same thing that your body makes, or would have made were it to keep making it. So what's the difference between bioidentical and biosimilar hormones, or the synthetic hormones? Well, this is the difference between man and woman. Okay, this is Adam and Eve, and the difference here is that this hydrogen atom right here is missing from testosterone, and that changes the entire thing. Everything else on here is the same. Now, obviously, this is a simplified two-dimensional structure of a three-dimensional object, but if you take off this hydrogen, oxygen is going to have a double bond with that carbon. Carbon's going to have 4 bonds, and so taking off this hydrogen changes the structure of the entire molecule, and now you have the only difference between man and woman is that hydrogen. So here are the differences between a couple of Premarins and one of the human estrogens, and it's very clear that they're different. And if the difference between man and woman is just one of those bonds, then what's the difference going to cause in here? And that's where we get all the damage done by the synthetic estrogens. Cancer risk. This slide's a little bit dated now, as of a couple of weeks ago. Women's Health Initiative reported on Prempro and showed an increased risk of cancer, especially breast cancer. No studies on bioidentical hormones have shown an increased risk of cancer. This really needs to be updated, and I should have updated it earlier today, but as of about 3 or 4 weeks ago, there was a study published that showed no matter what form of estrogen you're on, there is some increase in ovarian cancer. That's something that I need to counsel my patients on now. Again, it's not a really big impact in my office because I don't use a lot of estrogen. I don't have to. Most of my patients have enough on their own, but it's something that we'll talk about whenever you come and see me as to whether you need estrogen at all or not, and whether you feel like it's worth the risk of ovarian cancer. one thing about ovarian cancer is we care a lot about it because it's lethal and it's very difficult to detect, but it's not a very common cancer, thankfully, and a small increase in a not very common cancer across the world is still a small increase. It's not a very large increase, but if you have it, it's 100% for you, and if you don't have it, it's 100% that you don't have it. So it's just something, one of the complex things that we need to talk about in the office during the appointment. Andropause, this is sort of a new made-up word over the past couple of years. It now is in Mosby's dictionary, so I guess that makes it official.
Menopause.
Yeah, menopause. This is the changes in life that men go through that are not really recognized very well, even still. So we're all in here, talking about hormonal changes in women. In women, it's very abrupt, and women know that they're going to have this happen to them. From a very young age, we tell our girls, women, that at some point you will start having periods, you'll develop into a woman, and then at some point you'll stop having periods and your hormones will go away and you'll have hot flashes. And what you're not told is that you'll also go through these other mood swings and edginess and sleep difficulties and weight gain around the middle and stuff. But men are never told anything about a hormonal decline. Men just have this decline. It's very insidious. It's not abrupt. And men, I think, will be in denial about it because take your average 45-year-old man, got the career, he can get up, he can go to work, he can provide for the family. That's all he can do. He comes home, boom, he's on the couch drinking a beer, he's watching sports, watching other people do active things that he once did. And if you ask him, he understands that he's out of shape, overweight, doesn't feel well. He also becomes more depressed and withdrawn and doesn't go out and socialize and do the things that he used to enjoy doing. A lot of that's loss of testosterone, but he doesn't see it that way. What he sees is that, yes, I'm 45 years old, but in my mind, I'm really 19 or 20, and if I would, just as soon as I get the 401k paid off for the year, I'm going to cut back on the work, I'm going to sleep at night, I'm going to go start hitting the gym, and I'll be everything that I was 20 years ago. And that's just not the case. If you try to do that, a lot of times, you may get away with it, it may work, but it's not going to feel good. Working out hurts, and you don't get the immediate results that you're accustomed to having, and you thought you were going to go into the gym and just start blasting it out again and then feel great and look great again. That doesn't happen, so you give it up and you go back. It's a lot easier to lay on the couch and drink a beer. Our culture has allowed that to happen now, so that it's sort of more acceptable for that to happen. But really, this is, I think, in large part related to testosterone decline. And here it is in a graph, and you can see that it's a very insidious decline. Men's testosterone levels peak in the late teenage years or early 20s. At about age 25 across the board, it starts this decline. Now, what we see is that at about 700, or in the upper third of the reference range, and the reference ranges are different for different labs, but generally 300 to 1100, or you can just round that off to 1000, but the upper third of that is going to be over 700, so between 700 and 1100. And if we draw a line here between 700 and we carry that over here, we end up at about late 30s, 38, 40, 35, 42, something like that. That's when our testosterone line crosses 700 and when we start not feeling so well. We've had this decline going on for a while, but 700, there seems to be something about that I've noticed in my practice. And actually there are two studies that bear out the upper third sort of notion. There's the Rotterdam trial, or the Rotterdam study, which is in Holland, and the Rancho Bernardo study here in Southern California. These are longitudinal observational studies that have been ongoing since the 70s. And if you're familiar with the Framingham study or the Nurses' Health study or the Physician study, those are also other observational studies where we just kind of sit back and see what happens to a community so we can decide what's good for them and what's bad for them, because we don't know until we look at it and sort of analyze it. What these two studies have shown, and they're on opposite sides of the world, which is pretty amazing, but they've shown that if you compare men in the lower third testosterone levels to age-matched controls in the upper third testosterone levels, the guys in the lower third testosterone have a 40% increase in cardiovascular disease in Holland. So if you live in Holland, you want to have upper third. If you live in Southern California, you also want to have upper third because the endpoint for this study was death. So all-cause mortality has a 40% increase when you compare age-matched controls with lower third testosterone levels to upper third testosterone levels. And it's as important as LDL cholesterol as far as an independent predictor of death, of early death, if you control for everything else that you can think of that you might think that would kill us early. The one caveat about that is that gives you a pretty pleasing piece of data that says guys feel better over 700, and the data seem to show that you want to be over 700 for health reasons. But you have to remember those are observational studies, not interventional, so now we're intervening. It'll take us 20, 50 years. These studies have been going on since the 70s. If we fast forward now another 30 years, we may know if replacing testosterone is all that it's made up to be. That's, one of the downfalls is that we don't have specific data to be able to tell us this. We didn't have specific data to tell us a lot of things in medicine.
Hi, my name is Debbie. I've been coming to Dr. Landa for about 8 months now, and I was an absolute mess and a nightmare when I walked through the door. Found her actually on the internet via reading the books written by Suzanne Summers and what I've seen on Oprah, and she has helped me tremendously. I have lost 23 pounds, so I'm back to my normal size, and everything in my life has become normal again from what I remember it being. I have no more hot flashes, my sex drive is back, I have a zest for life that I really was afraid that I had lost. It's just, things are back to normal. So I love her, and I'm just really happy to be here and be back to me.
I began hormone replacement approximately a year and a half ago, and I was just floating off on a boat somewhere out in the sea. I really didn't know. I didn't have a lot of focus and concentration, and with what I do for a career, I really needed to. So I could tell that I was losing that, and I was not happy. I was always grumpy and not feeling well. So I came here, and it's the best thing I ever did. I have the Bio-Identical Hormone Replacement pellets, and they're monitoring my progress, and it's the best thing I ever did. Now I'm happy again. I feel alive, finally, after 2 years of not feeling alive. So I'm 51 years old, and I think it was time for me to make a change, and it's the best change I ever made. The results from the hormones is clearer thinking, just a happier outlook, and my mind is focused in the right direction, and I'm completing tasks, and I'm getting things done the way I used to get things done prior to my hormones becoming imbalanced. Worst case scenario is that I was very depressed. I wanted to stay inside. I did not want to be around people, and we only have one time here on earth, and we might as well make the best of it. And I am now back out, and I'm enjoying life. I said it before, but I'm alive again, and it's wonderful. My family has seen a big change in attitude, and just everything or about me, my mom said. And she said, I'm really happy that you're feeling better, and keep at it, keep going. So I plan on continuing. I have referred due to the fact that they've asked me, what has happened to you? You look great, you're so vivacious, oh my gosh, all your energy, what is going on? And that's when I told them about age management and the hormone replacement therapy, and they're here. So I referred them. And again, their results are amazing as well. So it's been a good thing all around. I felt like I was on a lifeboat floating out to sea with no direction. And after having the hormone therapy and the instruction and the accountability and everything about this place, I feel like now I'm back on the big ship of life and sailing, full steam ahead. I'm ready to roll, so it's a really good feeling. I had no energy to do anything, and this has really increased my energy level, as well as just opened my mind. And again, I've put myself on the priority list, not at the top, but I'm on the priority list. And to me, it's a good feeling, because with my family and my job, I was never on the list. So that's a good thing. I was in depression. I gained a lot of weight. I've already lost 23 pounds.
Excellent.
And I have about 15 or 20 more to go. And I'm still, heading downwards, and that's a good thing too, because it's hard to maintain. And it's not really hard to maintain anymore because I do have the energy to continue after I'm finished working. And before I didn't have the energy. And the levels are predicted by your blood work, which I am really excited about because I don't think your blood can lie. And you have blood taken and they send it into the laboratory and they come back and analyze where your hormones are imbalanced and at what levels. So your replacements are prescribed per what you need as a person and not what somebody else needs. So it's very personalized. My experience has been everything positive. They really know what they're doing. It's thorough, and again, I said it's personalized per your needs as myself, and that's really important to me. And I would recommend coming here to any one of my friends that feels like they're starting to recognize the signs of hormone imbalance. Energy, focus, excitement about life. My work is clearer and I'm completing tasks better, and at my age, to keep a job, you need to do that. Let's see, number 5 is just overall happiness. I can't even say enough about it. Just makes you feel normal again. I would say if you were sitting there on the couch watching me and deciding whether or not to go have your blood test and see if your hormones are imbalanced and to go to an age management or hormone replacement facility, I would say and encourage anyone to do it. Yes, go. You will be excited. You'll thank me and whomever's helping you forever. The greatest compliment that I got was that I just looked alive again, and that was from my husband. And so that made me feel really good. Well, that's important to me.
Hi, I'm Brenda Sherman. I'm a patient of Dr. Landa's here in Maitland, Florida. I've been coming to see her around 3 months, and I started my hormone therapy, and I have to say it is the best thing I've ever done for myself. I'm 50 years old. I feel fabulous. I started feeling better within the first week of taking my prescription medication. And when I came in, I was having night sweats. I hadn't slept well in so long. I wasn't irritable, but I just was tired. I was just so tired. And I can't tell you the difference. Oh my gosh. I have noticed, well, I have no night sweats. They disappeared in the first 3 or 4 days. I sleep like a baby. It's amazing. My skin is thick again. My hair is thick again. My nails are growing. They're beautiful. They're white. They're not yellow and brittle. I just can't tell you enough great things about what Dr. Landa has done for me. And I encourage you to take the plunge. Don't wait to see what the results are if your friends are doing it. Come on in and take time for yourself. Do something positive for yourself so you will continue to feel good through the rest of your days here on Earth. Have a great day. Thanks for listening.
Well, Ron and I were watching Suzanne Summers on Oprah Winfrey, and we looked at each other and we said, "That's me." And I called Dr. Landa, and I am a new person 3 months later. It is just the most fabulous thing I've ever done. I started out having severe night sweats, sweating all during the day, totally miserable. And now I just saw Dr. Landa today. 3 months later, I am like a new person, and I just can't tell you how happy I am. Thank you.
So who should consider hormone replacement? I would think
anyone obviously who has symptoms or thinks they may have symptoms, men and women 40. It's nice to start when you're perimenopausal, before you have all the severe symptoms and have no hormones. You can avoid all of that hot flashes, night sweats, irritability, just out of your mind, if you get your hormones checked a little earlier and deal with them as the time comes, because there will be changes. Sleep is a big one. I'd say if I had two symptoms that I absolutely had to talk about, it would be poor sleep and fatigue. Those are the two things that I hear most about. Now that doesn't mean nothing else is going on, but those are two of the things. Just think, if you're tired you don't sleep, so you're tired all the time, so everything is worse. When you don't sleep, the smallest thing becomes more difficult to do. And so those are the two things, the two major complaints that I hear about a lot. So if we're saying, okay, in the short term, now what in the long term is going to help? Certainly a long, continuing improvement in quality of life. There are studies now that are in the works, and I think what we're going to see is that we're going to see a decreased heart disease, as well as probably increase in cognitive function, or maintaining cognitive functioning. There is someone, A.J. Pike, him and his research group have done a lot of studies with androgens and estrogen and Alzheimer's and cognitive decline. Really interesting. I think we're going to hear more about that. Certainly we know it increases bone density. Remember, if you are 80 years old and you break your hip, 50% of people die within a year. If it's before that, 25%. You know, if we don't have our memory and we don't have our mobility, what I'm all about is quality of life. I think that medical advances have been made where we can keep a lot of people alive for a long time. And so what I'm about, and what I think is most important, and the sooner that you do it, not the later, the sooner you can actually achieve good quality of life and then maintain it.
Frustrated?